Council Advocacy Network. Region 5 covers Beauregard, Allen, Calcasieu, Cameron, and Jeff Davis parishes, just like the Families Helping Families of Southwest Louisiana Resource Center covers. But there's one of me in all 10 regions, with one person covering region 1 and 10 in the New Orleans area. So there's actually 9 live people, but all 10 regions are covered. So we're moms and dads, people with disabilities, professionals, people that care about people with disabilities, that combine together to work on systems change through legislative advocacy. So specifically, we work on home and community-based services like the NOW, the ROAD, the supports, and the Children's Choice Waiver, and things related to those like the Flexible Family Fund and individual and family supports and some healthcare things. And we work on special education issues, although that one's a little bit trickier. So years ago, when I started doing this, the only way you got a waiver slot is if someone died or moved out of state. And we spent, it was like 25, 28 years ago, we spent years working on getting more money into the system, to the point that between the state match and the federal match, we've gotten hundreds of millions of dollars into the system to get more waiver slots. We're at the point now that if you need a waiver and you know in the next 90 days to a year, you can probably get a waiver slot in the next 90 days. Now, it's not simple, but we can also help talk you through the process at Families Helping Families, of making that happen. But you don't have to wait years for a waiver slot like you did years ago when my daughter got her waiver. There's other things around, like I said, home and community-based services. We're working on our legislative agenda right now. The LACAN leaders and the executive directors of Families Helping Families have put together their proposals for the next legislative session. It goes to the DD Council, so there's still time before the DD Council meeting next month for you to have input on the legislative agenda, but the DD Council actually makes the decision. We work on their legislative agenda at that point. What else? Special education. So like I said, that's kind of tricky. If it is an issue that's covered under federal law or state policy, you have to go that route to work on the issue. But there are issues that haven't been, and probably there are issues that still aren't covered under those things. So one of them was like restraints and seclusion. We had guidelines in prisons and in hospitals, but not in schools. There is a law that works on guideline on the parish, LEAs. It's not always a parish, to have policies and procedures around restraints and seclusion. There was school systems that weren't allowing outside providers into the school. There's a law that basically says that they have to make up policies and procedures and do that. Now, I'm not going to pretend like either of those laws are perfect, but there's something where there wasn't anything. There's something to work with. What else? Oh, so like at one point in Louisiana, the only way you got a diploma is if you were headed to college. With the April Dunn Act, the vast majority of students in special education receiving special education services can get a diploma now. That's been a really good one that we talk about every year, multiple times a year, with families about at Families Helping Families. But LaCan was instrumental in getting that passed. A lot of agencies worked on it, though, by the way. So I'm sure, let me check the chat box. Wallace has dropped the link in there. Good. It doesn't cost you anything to join. When you join, you're agreeing to get email. The email is going to teach you more than you ever thought you wanted to know about the system for people with disabilities. Of course, as the team leader, I'm hoping that at times you're going to email your legislator or contact your legislator about the issues in those emails. I'll even be asking you about if you've done it or not, or if you need help or not. Of course, some issues are going to be more important to you than other issues. And sometimes you're going to be busier than other times, so you do what you can. Those issues that are important to you, I'm always looking for people to tell their story in a variety of situations. We have individual meetings with legislators that you can tell your stories at. We have a legislative roundtable every year. Let's see, Senator Abraham and Senator Stein attended last year and co-hosted. And we've always had good response from the senators and state senators and state representatives in our area. Some people are going to go to Baton Rouge and testify in front of a committee. Granted, there's not very many people that are going to do that, but we've had various people from Southwest Louisiana do that over the years. Not everybody, though. So I have lots of opportunities. You can tell your story if you bump into your legislator at the, Harvest Festival or wherever. That story becomes really important to the issues we're working on during the legislative session. If you have questions, drop them in the chat box, and I will be on the webinar and able to answer questions. But I don't see any questions right now, Davelyn, so I can give it back to you.
Thank you, Miss Melinda. Normally, I have a slide for LaCan. I neglected to do that this time, but as always, Wallace is helpful and has the information for that in the chat. And as Miss Melinda said, if you have any questions or need to direct anything to her, she's here at the office or can take care of that before the webinar is over. Thank you, Miss Melinda. I appreciate it. Always good information to have and very relevant. So for the purposes of sound quality, you may realize that you don't have the option to mute or unmute. We want to make sure that Miss Karen can be heard clearly and we can get all the good information she has. I want to let you know that when we finish the webinar, you'll be prompted to complete, or should be prompted to complete, a post-event survey. You'll get that in an email when this is over later today, just in case you missed that opportunity. And then I want to let you know too that the webinar is recorded. You probably got a message about that. So Miss Karen works with Special Needs and Parent Support Services of Louisiana. She is super helpful. She's an incredible resource, and I'm so glad we have her today. She's a family member to people with disabilities, and she walks the talk. And so that makes her a really excellent resource and valuable resource. She's going to share with us today information and updates about open enrollment with Healthy Louisiana. And she's going to answer your questions at the end of her presentation. So send those by entering them into the chat as they come to mind, and we'll make sure we take care of them before we get off. With that, I want to welcome Miss Karen again, and I will pass it off to her. Thank you again for being here.
Thank you, Davelyn. I appreciate that. That was a really sweet introduction. As Davelyn said, I am with Special Needs and Parent Support Services of Louisiana. And I am both the mother of someone with developmental disabilities and the wife of someone with significant adult onset disabilities. So, you know, we've been through a lot. We've navigated quite a few processes in Medicaid and in state services. So today we're talking about Louisiana Medicaid open enrollment. So open enrollment's coming. Let's see, let's go to the next slide. Oh, this is my contact information. I can go back to this at the end. I usually put a slide at the end as well, but I'm not sure if I have one on this one. If you need to reach me, I have a dedicated line. That's the 504-300-5117. That is for anyone calling for assistance. Primarily, I do Medicaid, but I've also helped people with a lot of our individuals with developmental disabilities get to a point where they are eligible for Medicare. So Medicaid, Medicare can be dual eligibility, can be a little difficult to navigate sometimes. You can reach me at the email for the special needs and helpline email address or Facebook Messenger, and you can find the website, the Facebook site by @SNAPSLA. Now we'll note that on the website, I've recently put some updates on there. If anybody on here is with self-direction, there is a updated self-direction handbook. That link is on my website. Just wanted to make note of that for anybody who may be using self-directed waiver services. Trying to get that message out. Okay. So this is the first thing that's come out, push on information about the new open enrollment. It is going to start October 15th. It will end at 6 p.m. November 30th. That's the usual time frame that they give us whenever we have an open enrollment. You can change your enrollment or look at different plans at the myplan.healthy.la.gov. If you don't remember that website, you can just put in Healthy Louisiana My Plan in a Google search and it will come up. So one of the things that's going to happen is you're going to receive a packet in the mail. And I worry a little bit this year because I think we're all kind of overloaded on knowing that there's a packet coming, or we're still in open enroll. We're still in renewal process. We will be going through renewals to the end of the year and probably beyond that, clearing up anything that may have been incorrectly renewed. So we have renewal information coming out. We have people getting waivers, and that information comes out in the mail. And now we have another packet coming for enrollment. So it can be a little confusing. But this is what the envelope would look like. You can see on your screen. And one of the most important things to remember about this whole process, just this process, is if it isn't broke, you don't have to fix it. If you've got your coverage the way you want it to be in Medicaid, whatever the plan is you have, whatever the doctors you're using, if you're getting your services, you do not have to do anything. Okay, because that should absolutely roll right over into the next year. All right, let's talk about the next slide. So what exactly is open enrollment? For anybody, I have a lot of families in Medicaid who, either didn't have insurance for a long time or really, they're new to insurance and what it means. So for private health insurance, an open enrollment period is going to be that time when your employer, usually the employer, tells you, hey, okay, we're going to do your yearly review of what your needs are. Let's check and see which plan you want. Go ahead and look at what is going to work for you in what we offer. In Medicaid, that open enrollment, that's an opportunity for you to change your Medicaid services from one managed care plan to another without any cause or reason for it. If other than that, this is just a plan that you would prefer. The services, it's important to remember that every one of the plans and legacy Medicaid, which we'll talk about in a little bit, they all have to offer the same services, the same basic services. That is called the Louisiana State Health Plan with Medicaid. Those are all the same services. They have to have a network for each of those services to provide the services to everyone in the state, no matter where you live. Open enrollment is the only time you can make this change in health plans without some other qualifying reason, like a for-cause reason. So you can't make it another change from in Healthy Louisiana plans unless you have a reason to do it once this kicks in. So it's important that if you're going to make a change, you really make sure that all the doctors and everything that you want is going to be in the plan you're moving to. So right now you're going to see information on really 3 different types of open enrollment. This happens every time we do open enrollment. They're all kind of meshed together at the same time. So Healthy Louisiana Medicaid, that's October 15th to November 30th at 6 p.m., as I said. But Medicare also has an open enrollment running right now through December 7th, or from October 15th to December 7th. And then the Affordable Care Act, those plans have an open enrollment that runs November 1 to January 15. So they kind of overlap. And it can be confusing because you're hearing lots of different things. I know lots of my families really confuse Medicare and Medicaid. Medicaid being a state-funded, partially state-funded federal program for healthcare, and Medicare being fully federally funded. So what we are going to be talking about today, we are really talking about just that Healthy Louisiana Medicaid managed care open enrollment period. Again, October 15th, it begins, and November 30th at 6 p.m. it ends. Anything after November 30th at 6 p.m., wherever you land, whatever plan you have, that will be the plan that you will be enrolled in for all of the following year. And it takes effect January 1st of the following year. So whatever change you make between October 15 and November 30, don't expect it to take effect until January 1st. It's not going to be like, oh, I did it, right now. If you had some kind of for-cause change, if you did it on October 15th, it would take effect on November 1st. So this is not for-cause change. So this is all the open enrollment, regular ability to make a change without any reason, and it takes effect January 1st. So now if you want to learn more about what the different plans are and what they offer, what their comparison is, this is what we talked about, that Healthy My Plan website. This is the enrollment broker's website. And on this site, you have access to how to make a change. You can make a change online with them. You can go on an app and do it, call them and make the change, or make the change by the paper enrollment form that you're going to receive in the mail. Now, if you look up at the top, you'll see Learn, Choose, Enroll. So Choose is going to be where you go to look at the different plans, and you can actually do a comparison of plans in that little section. You can pull up, and this is just like a screen grab of the dental, and you can see here in the center it says select service. So if I selected medical, I would get a list of the different medical plans, and I could check off which ones I wanted to compare. That would give me that information. So members are going to make their choices either, as I said, online at myplan.healthy.la.gov, or by using the mobile app, by calling Healthy Louisiana Enrollment Center, or by completing the paper enrollment form that comes with the open enrollment letter. This is something that is really a personal choice. I think they're trying to give people a lot of options. And I really like the fact that it can be done through the mobile app, because I know a lot of our young people are more comfortable just using apps on their phone to make these kind of choices and take care of this kind of personal business. But the phone, it's perfectly acceptable either way you do it. I would suggest that if you do a paper enrollment and mail it back, just keep a copy for yourself. I'm just a big proponent of that. If you do have the ability to scan it into your computer or keep a copy, even take a picture of it on your phone, that's fine too. So you know, you're not having the expense of copying expenses or ink and that kind of thing, because that can run into a pretty penny. So yeah, just keep something that, you know, you can have for your records so that you can show it was completed, just in case, I always tell people be prepared. So let's talk a little bit about the apps. Now, this is the app for the enrollment. This is the logo that you're going to see for the app. So sometimes it helps when you're in the app stores to look for the right logo, because there might be several different things on different companies that have, you know, all different kinds of apps. So this is the one you want to look at to go ahead and use that to register, to enroll. But you can do a lot of other things on this app. So you can go in and log in, set your login and everything. But look at the right picture on the right. You can compare plans on this app as well. So you'll be able to see different things that the plans offer. Now, you might want to ask at this point, well, Karen, I thought you said everybody's got the same basic services. Why would we have to compare? So here's the thing. They do have the same basic services, but number one, you might want to compare doctors in the plan. And number two, there are some perks that are very important to some people. If you're really healthy, you don't have to worry too much about, you know, which particular providers you're using. Those perks may be really important to you, and maybe something in there that you want to see. But the main thing you need to look at, and the main difference in the plans, is going to be in the network. Who's the providers in their network? Who's going to work for you? So as you see, you can also find providers if you're in the Healthy Louisiana app and you need a provider. You can take a look at the plans, but it just gives you a lot of options. And you know, the app online, they're all good. So let's talk about what are your choices, and making choices in this can be a little confusing. So for dental care, there are only 2 dental plans to choose. There's DentaQuest and there's MCNA Dental. So it's really going to be important for you to check with your dentist, find out which one they plan on taking next year in order to get your coverage for your care. Just a note, individuals who are on developmental disability waivers in Louisiana are eligible for continued comprehensive dental care, not just the dentures. So if you are an adult with a developmental disability, or a family member of someone who's an adult with the developmental disability, they're on waiver, and you call DentaQuest or MCNA Dental and an individual tells you they're only eligible for dentures, that is wrong, I can promise you. So if that happens, you can call me, you can call Medicaid, you can call and ask for someone, a supervisor at the plan that you're calling, but that's absolutely incorrect. So we can get that straightened out for you, because we want to be sure our waiver participants are getting the care that they need. So this is a contact information for them. And you can also go online to DentaQuest MCNA, and also online to the managed care organizations that we're going to be talking about too. You can talk to them mostly 24/7. Some of them aren't. MCNA 7 a.m. to 7 p.m. is pretty comprehensive. But, you know, give them a call. Talk to them about their program if you want to. Now, healthcare and behavioral health care. So there's 6 choices now, and this starts to kind of get to be a lot. I understand. So rather than necessarily delving deep into websites and what's on their plan, you can do all that, definitely do that. But I really encourage people to talk with the providers that are very important to them, that are the most important to them, and not just ask the front desk, what do you take Medicaid? People do this all the time. They'll say, oh yeah, who takes Medicaid for this? It doesn't matter if they take quote unquote Medicaid. You have to find out what plans they take, what network are they in, because it's not going to do you any good if you're not in that network. You're not going to be able to get that paid by that provider. So if you have a relationship with your provider's offices, most of us who have kids with any kind of complex needs or family members with complex needs, you get really close with some of the people in the office. Check with that billing office if it's possible. Double check with whoever's handling billing to send it out. What do you anticipate are the plans that you're going to accept next year? Because they may even be in a contract with a plan this year and not plan to renew that. You want to really double check that to make sure that you're still going to be able to see those doctors that are just so important to your continued care. You can call any of the plans. They're helpful. They will help you on the phone, work with you to, make sure what their network is now. You can go on their websites and find out quite a bit more about them and what extra services they offer as well. So those are some important things, but just mainly check with your providers that you want to keep. Now, every one of the plans also have their own app. They're required to have their own app. I strongly encourage anybody who has Medicaid to download the app for their Medicaid plan. Connect to their account to that app so that you have, especially in emergencies, a copy of your card in that plan. It'll be in the app and you can pull it up in the app. And I say this because there's been a lot more emphasis both with OAAS and OCDD with regard to emergency preparedness. This is a very important emergency preparedness tip. If you have a Medicaid plan or any health insurance plan, you're going to have a card for that plan. But we want to have more than one opportunity to be able to access what we need. You may not have your purse with you or your wallet with you if you have to run out in case of a fire. But 9 times out of 10, we've got the phone sitting on the nightstand, right? Because that has our alarm clock in it too. So if you're getting up to run out from a fire or have to leave in 5 minutes because of a chemical leak in your area, you grab your phone, your card's going to be in there. You're going to have your ID card if you have to go to alternative medical care. So it's really important to do that. And if you also notice, this is Aetna. I'm going to show you some of the other ones as well. But they give you an opportunity to see a list of your current medications. Now that's going to be really helpful too, because if you're under stress, you're in an emergency, or even you see a new physician for any reason, and they ask you what your medicines are, you've got them right there. Those two things, I think, can help eliminate a tremendous amount of stress sometimes when we're shuffling through our things in our wallet trying to find a card. So really important tips on downloading those apps, both for Healthy Louisiana and for the plan that you ultimately will be enrolled in, or whatever plan you have now for those purposes. This is the one for Aetna. It's called Aetna Better Health. You can see the logo in the upper right-hand corner. So that's what you're going to want to look for in the App Store. Here's a screen grab of things that you can do. Find your provider, look at your profile, your medications. This is a opportunity for you to see your Aetna card. This is kind of what it looks like, so you can get an idea of the app. This is Healthy Blue's version. You can see their logo in the upper right corner. When you log in, you see you can view member ID card, check symptoms even. They have some opportunities for you to find physicians by doing a search, and you can see your Healthy Blue card there. You can see both sides of it, which I think is really cool, and then view it full screen. That's a nice little feature of their app. Louisiana Healthcare Connections, lots of information there. Find the nearest hospital, I think is a really good feature of their app as well. So you can find providers, etc. That's their logo in the upper right corner. This is United Healthcare Community Plan. Now, there's some things I really like about this one. When you do that search for doctors, or let's say urgent cares, you can see on the right, this one's going to give you a little map. It's going to tell you how far away it is. I think that's a really cool feature on this app. And then I like the idea that you have this on the side. How would you like us to contact you? They can email you, you can talk with a nurse, you can have them call you later or call you now. So some good features in some of these apps. This is the view of the United Healthcare Community Plan identification card. And you're going to be able to load more than one family member, so you can see all the cards as well. There's their logo in the upper right. This is AmeriHealth Caritas, as you can see. Message center ID card by doctors, resources, pretty basic. There's medicine cabinet. That's where you're going to find your care. I like that it breaks down hospitals, specialists, pharmacies in there when you're doing searches, as well as primary care physicians. And this is the new plan. This is Humana. Humana has pretty much the same or similar opportunities for information. You can, I like the fact that you can look at your claims on there. I'm not sure that's available with the other plans, but I've had a lot of people tell me, I want to see what's going to be billed. I want to double check that things that are being billed to Medicaid are correct. And so you're going to be able to look in there and see those claims that you have had submitted, and get an idea of what's kind of going out to Medicaid, in case you're having any issues with, God forbid, identity theft or anything like that. So you can take a look at that. And there you go. So now let's talk about legacy Medicaid, because this is kind of one of the things that tends to trip people up a little bit, and not really sure they know what they're doing with legacy Medicaid and why we have it. So this is an alternative option for healthcare only for some very specific populations. It is a mandatory opportunity for some other populations. So legacy Medicaid really is just our old fee-for-service system. Years ago, before all these managed care organizations came in and we had all that in the Bobby Jindal era, everything, you got a bill, you went to a doctor, the doctor billed Medicaid, Medicaid paid. Go to the doctor bills Medicaid, Medicaid paid. There wasn't much oversight of all of that. And so costs were through the roof, and there was a lot of things that were submitted that shouldn't have been, and weren't appropriate, and it did not lend itself to managing out people who were doctor hopping and that kind of thing. So that's when the managed care organizations came in. Now, so if that was a problem, why do we still have it? Well, legacy Medicaid is vitally important to some populations. There are people in the state who can only get some of the supplies they need from a very specific pharmacy, the only pharmacy in the state that carries it, and that pharmacy only takes legacy Medicaid. It may add a little more confusion to the pot, but it's a very important choice for people with complex care needs. So it's important that we have that, and we know why we have that. Not if you don't need legacy Medicaid and you don't need that for anything, by all means, if you have all your stuff into your managed care plan, that's where you need to be. That's what's going to be best for you. But we need to keep individual choices out there for families, for individuals who need these choices. It is, again, only for specific populations, only for healthcare services. And when I say healthcare, I mean your doctors, your therapists, OT, PT, speech, and your pharmacy. You still have a plan for behavioral health, which is one of those 6 managed care organization plans, and you will still be enrolled in a dental plan, which is one of those 2 dental plans I discussed earlier. So who's required to be in legacy Medicaid? Individuals who are duly eligible for both Medicaid and Medicare are required to be in legacy Medicaid. You cannot have all your health care in a managed care plan. and LHIP participants. So what's LHIP? LHIP is Louisiana Health Insurance Premium Program, and that is a program that individuals can apply for, which, if you qualify, will pay for the private insurance premiums as an incentive to keep you in your private insurance plan to reduce costs to Medicaid. And the basic idea is, if it's more cost effective for the state to pay for your premium, and they pay the adult, that is the, I guess, the employee who has access to the employer insurance, they pay for their premium and the child's premium that they're having covered. So that would be two premiums that you get reimbursed for, and they send it in the form of reimbursement. Whatever that costs, so say it's $5,000 a year. If the child's medical claims far exceed that, then it is within the state's best interest to incentivize you keeping your private insurance. Because if you dropped it and your child was solely on Medicaid, Medicaid would be on the hook for those higher premiums. Now, it doesn't work that way if you're in a managed care plan. If you drop your private insurance and you go into a managed care plan, your care's managed out. The state is only going to pay that managed care plan a fixed amount. They know what that cost is going to be. Other than that, if it costs more than that, it's on the back of the managed care plan to accept that risk. So if you apply for LHIP to get the premium reimbursement, you have to be in legacy in order for it to be cost effective. And that's why that rule is there. Now, one thing I worry about, and this has happened a few times now, that people aren't quite sufficiently educated before they fill out the LHIP application. And they may not realize that it will, if they're accepted, it will automatically put them in legacy Medicaid. So I have had a few people that didn't realize that, and it was quite problematic. The reason it was problematic was because they had children in OT-PT speech who generally run on a 3-month renewal of prior authorizations, and they were going to the therapist, and then all of a sudden the therapist sent the bills in and they weren't covered. And that's because in the midst of that 3-month period, they had been switched over to legacy. Well, parent maybe didn't understand or didn't know, and the therapist maybe wasn't checking the verification system every single time the child came, because it came like every day. So those providers are going to be on the hook for that amount of money. It's very problematic in that sense. So it's really important that our LHIP people know that if you get approved, you're getting put in legacy Medicaid. So who's eligible for legacy as an option? That would be children on the waiver or individuals on the waiver registry who have Medicaid, and individuals who are receiving Office of Citizens with Developmental Disability and Office of Aging and Adult Services waivers, who are actual waiver recipients at the time. So they have that legacy option. One of the cool things about the legacy option is you can move in and out of legacy Medicaid, out of legacy into your current Healthy Louisiana plan for your healthcare services in any given month. So you don't have to wait for open enrollment to go back and then forth with changing from your healthcare from legacy to the Healthy Louisiana plan. And there may be some reason that you need to do that. You might be having an issue in legacy, or you might be having an issue in your plan. You need to get it resolved. You may go to legacy to get it resolved for a little while. After it's resolved, you can go back to your Healthy Louisiana plan. You just need to be really sure when you do that, when you talk to enrollment, that number one, they understand what you're doing, but number two, they give you a date where it's going to be effective, so that you know for sure you're back in your managed care plan or back in legacy as you chose. They will, at the enrollment phone number that I originally gave you for open enrollment things, you call them for it. If you're going to make that change, and you need to be sure that what they're going to do first is they're going to ask you for all your information, and then they're going to go to Department of Health, Medicaid, and they're going to verify, are you eligible for this? Because they don't have access to whether or not you're on the registry or you're a waiver recipient. So they're going to go check with Department of Health, and Department of Health is going to come back and say, yes, this person is optional to move back and forth. And then at that point, they'd make the change. And then, of course, you need to know when that effective date is going to be, so you know which network you're dealing with. Okay. Again, who's eligible for the legacy option? We said it was those children on the waiver registry or people in the registry, and OCDD and OAAS waiver participants. So you're going to enroll through the same number. Again, I skipped up a little bit. They're going to verify your eligibility. You can move back and forth at any time. Doesn't require open enrollment, but you still have a Healthy Louisiana plan for behavioral health. That does not go away, and you can move back and forth. Now, this is only back and forth with the plan you're currently registered in. All right, and that's pretty much the nuts and bolts of open enrollment. I think that, yeah, we have some time for questions. So I'm guessing, Davelyn, do you want me to just check the chat for questions?
Whatever you're most comfortable with. There are a couple that came in around the time where you were talking about legacy. So that's where
Sure.
those apply. Or I can read them, however.
Oh, okay. So there was some questions about the sound. I did not know about that. I'm sorry, and I apologize for that.
No, and I think unfortunately that's individually fixed, I believe. As far
Okay.
as I know. That might be something I don't know. Very possible.
So Rebecca asks, what are the circumstances for people to be dually eligible? So that would be anybody who's eligible for both Medicare and Medicaid is a dual eligible individual. Let me give you an example of when maybe a parent of a child with a disability may have a child that is eligible for Medicare and becomes dual eligible. So for instance, Kevin has a disability, he's on the waiver, he's getting Medicaid, he's got long-term care Medicaid. My husband became disabled and he had Social Security disability. When he became Medicare eligible, Kevin also became Medicare eligible because he's drawn off of his dad's record. So Kevin became dually eligible. There is also some very specific rare diseases that that automatically make a child eligible for Medicare. I do apologize. I do not have that list or a link to that list off the top of my head, but I have encountered and assisted some families that were in that situation. So Rebecca also asked, is there an app for Legacy Medicaid, or is that the Healthy Louisiana app? Unfortunately, there is not an app for Legacy Medicaid. The Healthy Louisiana app is really for enrollment. It's not going to be able to give you a provider list. So there is actually a mechanism, search engine available on the Gainwell website, which is lamedicaid.gov. I'm pretty sure it's .gov. I'm gonna double check that, but I'll make sure Devlin gets that. There's a provider search engine there where you can go in and click the region or the parish you live in and get a list of providers in there. Now, it does not have a lot of very highly specialized people there. And when you get down to that, sometimes it's just going to be a matter of contacting providers that provide that service in your area to see if they accept the Legacy Medicaid. It can be a little more difficult navigating finding providers in that respect. I've worked with the state to call to their attention some things that were missing from there. They've since added them. If you use that app and you notice that there is a gap in what the app, what the search engine can give you, then please let me know. And because I have some people I can talk to, I'll send that in through my channels and make sure that someone is looking at that, building that list and putting that list into the search engine. Does legacy cover eye exam and glasses? Well, it depends. I don't think that that's available for adults. For children, it should be. But again, it's a matter of providers. And if you're unable to find a provider for your child in legacy, that's something we need to look at. But that also might be one of the reasons you might choose for a month or two to go into your managed care plan to maybe have a bigger network to access that service. So Gina says, does legacy cover therapy services? So yes, certain therapies, it's going to cover anything that's not behavioral health therapy. It will cover, legacy covers OT, PT, and speech therapy services. Now, if you're talking about ABA therapy, counseling, any type of behavioral and mental health therapy, addictive disorders therapy services, that is all going to be covered under your Healthy Louisiana Plan, no matter what, because we do not have a system for legacy in behavioral health. We only have a legacy system available for healthcare and pharmacy and those OTPT speech type services, those type of physical rehabilitative services. Okay.
Can you explain that? Like if there's a short version, I don't know how many people would have questions about it, but I know in the past, in the clinic setting, families would have at least 2 cards, if not 3 cards, and be unaware that there is behavioral health and Medicaid separately. And maybe that's not relevant to this topic, but
oh no, it is. It really is, because it's all about enrollment. It's a really good question, Dablin, and it is something that comes up quite a bit. So legacy Medicaid, the way I tell people to look at their cards, let me address that first. So if you have a card from a Healthy Louisiana plan, you should also have a white card that says Healthy Louisiana on it. It would have something called a CCN number. It's a very long number. That's a card number. That card number is associated with you in Medicaid, no matter what, no matter where you are, no matter if you're in managed care, everyone should have the white card and a managed care organization card. If your managed care organization card says BH only, some do, some don't, it still may be behavioral health only. It doesn't say it, but if it does say BH only, then your behavioral health, including ABA therapy, counseling, psychiatric care, nurse practitioner, psychiatry care, anything in addictive disorders, that's where that's covered. And then your white card should have an RXBIN number. RXBIN is a hint. That tells you where your pharmacy is. If we were growing up, if you're old like me, you're growing up with Rexall drugs or all these drugstores, and they would put RX. It's a RX is a short form of prescriptions for prescriptions. So RXBIN number, that gives you a hint where your healthcare services are. If it's on the white card, you have legacy Medicaid. If it's on your Healthy Louisiana plan card, that would be the Humana, the Aetna, all one of those 6 plans. If it's on there, you have everything in that plan. Now you still should have and hold on to that white card, because it could be necessary for you at some point, especially if you lose your card for your plan. It's a hint that Medicaid can say, okay, let me look up your CCN number and see what your coverage is. They can help you with that. But your main card would be your managed care plan card. What's covered under which? So as I said, behavioral health is always going to be in the managed care plan, one of those 6 plans. Addictive disorders, anything like that. Your child's ABA therapy services, they always are going to be under that Healthy Louisiana, Healthy Louisiana managed care plan. Aetna, Humana, United Healthcare Community Plan, one of those. If your child is getting any other services or needs any other services, that's the doctor, main primary doctor, any specialty doctors for healthcare, endocrinology, your ENT, pulmonology, cardiology, gastroenterology, orthopedics, all of that. That's what we call healthcare, and your pharmacy. If it's in legacy, you use the white card that says Healthy Louisiana on it with the CCN number. If it's in legacy, that's the card you would use. If it's in the managed care organization, you're going to use that managed care organization. So that is that healthcare service. It's your pharmacy. It's when you go to speech therapy, OT, physical therapy. That is what we're talking about for your healthcare services versus behavioral health. I hope that helps explain it. Did I just make it more?
No, that really, it does. I mean, I kind of feel like families would come in and be like, I have these cards, and thankfully, somebody could kind of help them out. But I appreciate that those services are
Well,
accessible. It just sounds confusing.
Something else that can help, Davelyn, too, because your providers all have access to the medical eligibility verification system. So they're enrolled in any of the plans or legacy. They have access to that same system. And when you come in and you present your cards, they look at the cards, they're supposed to be able to pull you up in the system. And they can pull your name up, or your child's name, by your name and your date of birth. It can come up. So when they look at that on that screen, if they're a healthcare services provider, OTPT speech, they look at that, they're going to look where their service is, and it's going to say healthcare, doctor, physician, OTPT speech, whatever. And you're going to go across, and it's going to tell you who is responsible. And there's a line on that form that says, if a managed care or case management agency is not listed, claims go to Gainwell. So it tells them right there, Gainwell Technologies is the contractor that processes those legacy claims. That's how they can tell. Now, some of the providers don't know that. Some of the providers don't really understand that. So they may take it and go, oh, here's your plan. They're so used to it using just the managed care plan card. They may submit to that managed care plan. It's going to get rejected. I mean, you can't submit OT to behavioral health only provider, insurance managed care company. So it's going to get rejected. And I deal with this a lot. I mean, I know exactly what it is when it comes up. And most of the time I'm able to get on the phone with the parent and the provider, tell them what to look for on their screen, tell them where it needs to go. And then I give them a list, the provider, a list of some of the phone numbers that they have access to, that they can call if they have questions about that kind of thing, to make sure it gets submitted. But they really should be training their people to know and understand how to recognize where that needs to go. And billing departments, some big billing departments usually are pretty good about it. I've had a couple of people call me last week that they had services at Children's Hospital, and LCMC billed the behavioral health plan for a legacy claim. So we were able to get on the phone with the billing department and make sure things showed up correctly on their end, on their system and their billing department, and make sure those things can be worked out. And a lot of times like that, most of the time I don't even have to send that into Medicaid to get straightened out, because that's something we can do. I can do on a 3-way call with the parent, easy peasy. And then the company will just resubmit the bill to the proper entity to get paid, or the provider. So
That's good. That's good information. I do see where another question came through the chat. Can a provider take one of the Healthy Louisiana plans and not legacy Medicaid?
Absolutely.
Yeah.
And this is where the choice, your choice of networks is so important. You're really choosing your network. A provider can take one Healthy Louisiana plan and nothing else. They can take all 6 of the Healthy Louisiana plans and not legacy. They can take legacy and none of the plans. They have autonomy too to make those choices. They can choose which ones they feel they're more comfortable dealing with. And generally their decisions are based on how much trouble they have getting paid or getting, prior authorizations through, et cetera, et cetera. So yeah, they can pretty much take whichever plan they want, and that can change year to year.
It's really not something to do haphazardly if you can help it. Especially if you have a child that has Medicaid and has special healthcare needs, excuse me. It's really something, and it takes some time and it takes some digging, but it's worth it, because what you don't want to do is get in a position where you can't access the provider you've had for 9 years, or a provider that isn't going to be able to do the things that you need. But there's support and there are resources for that. So, call Families Helping Families, or call here and we can tell you who's in your area. Call Karen if it gets to that point.
And
we
go
definitely
to
want to make
that
sure
enrollment website. Just start tooling around in that, and look at the network and say, make a little list on a sticky of the doctors that you want to keep. As far as and actually Medicaid, I want to say this too, David, because this is really important. Medicaid has made it easier in a way, in one way in particular, because it used to be every one of the plans had a different network and they all had different preferred drug lists. So you not only had to look at whether the plan was going to continue to take your doctor, or your doctor was going to continue to use that plan, but you had to check and make sure your child's medications were going to be on the list. But we don't have to do that anymore. There's one universal list for medications. It's a preferred drug list. All of the plans have to use that, including legacy. So that is not an issue any longer. And just so you know, if there's something that's not on the list that your child needs, it's not specifically on the list, but it's medically necessary, there's some overrides that can be done too. So it's not so much a question anymore of getting denied because we just don't have that drug on our list. So yeah, thank you, Rebecca. I'm glad that was helpful and clear. I worry about making sure these discussions are clear to our family members because they are so important, and it is a complex system. It is a behemoth. It's just big. It's big. It covers a lot of people, a lot of people. So
when this is kind of where LaCan and this presentation overlap, because there is always the possibility that you can advocate for something that is not covered, or someone who is not in network. Not an easy task necessarily, but those skills that you learn in that one area can transfer over into this as well. Because if you need what you need, and it's not a perfect system, not an easy system, but yes, very, very good information. Thank you.
But it's life-saving and it's beneficial because there are things in any of these plans and legacy that are not available through private insurance or insurance plans that you buy on the market. This is why Medicaid is so vitally important to people with disabilities. And you're right, Davelyn, that advocacy piece with parents, I've seen more done in the last 8 years or so than I've seen in a very long time. And I've been doing this a very long time, working with Medicaid. We see TEFRA, that was all parent advocacy, all of it. The Family Opportunity Act Medicaid, way back when, that was all, parent and grassroots advocacy efforts, along with a department that's open and wants to make sure that people are served and served correctly and that they're getting services that they need. So I think a lot's happened that's positive in that result, that realm. And you're right. That's a good point to bring up.
I totally agree. Look, guys, I know we've hit our hour mark. Please fill out our survey. Tell us again how thorough this was, how important this was to you. We didn't manage to get this particular webinar in last year, but it's so important as we're coming up to this point where it's time to make some of those decisions. It's time to make sure those doctors are still going to be in network for your plan next year. Tell us what else you're interested in. We can't offer it if we don't know you need it. We always want something that's relevant. And Miss Karen looks at this feedback too. She's using it too. She's making sure that she's meeting your needs while giving this information. So Wallace has put that link in the chat for you. You will also receive it in a thank you for attending email, as well as a version of this PowerPoint when it's available. This was recorded, so you can go back and listen to it later if you feel like you missed something. But do fill out that survey. Call us if you need anything. Know that she's also available if you need anything.
Absolutely.
And thank you for joining us today. It's been
And
great.
Jacqueline,
Thank you so much.
I'm going to send you a copy of this presentation in PDF format that you can distribute to the
Perfect.
attendee list as well.
Perfect. Thank you so much. Thank you for being here. Thank you for giving us your time. Thank you to the participants as well. And have a great Friday. Happy weekend, guys. Thank you, Miss Karen.
Thank you. Y'all take
Yes,
care and have a
ma'am.
wonderful weekend. Bye-bye.
You too.